The professionals at Tulsa Spine and Rehab have many techniques at their disposal to help address the ache or pain ailing you. A relatively new one of those techniques is the fascial distortion model. Dr. John DiMaggio joins us to talk about it. Dr. DiMaggio, what is FDM?
So it's developed by an osteopath, and what he discovered was over treating patients for several years and studying anatomy on cadavers and things like that, more often than not, when there's a soft tissue injury, there's a fascial component, and that's often not addressed. So separate from some of the things that myofascial release cover, Graston, ART, they're all great techniques, but they sort of only address the tissue or the fascia that's trapped between your thumb and the muscle at that time you're treating the patient. So what he discovered is that based on a lot of patient body language, so it's all pretty much subconscious, the way they describe their pain, whether it be dragging their finger over a certain point or really grabbing a spot or digging in saying, I just can't really get enough pressure on it, or I can't really find the exact spots really deep in there. Like all these different cues that the patient uses help the doctor to determine, first of all, what distortion they're describing, and secondly, what treatment they'll use to repair that distortion.
So when we talk about the word fascial, what is that exactly?
So fascia is a connective tissue covering the muscles in the body. So when you contract one or many, it helps them sort of work together. So through whatever mechanism of injury the patient may have experienced, likely if you've strained a muscle or if you've damaged connective tissue like that, you've done enough to hurt the fascia as well. So this stuff covers the muscles. It kind of helps them work together, but it also keeps it also is an organ in itself. So you can damage the fascia, and it's highly innervated, and it's very uncomfortable if it's hurt.
So for the fascial distortion model, are we talking about primarily a diagnostic tool, or is it also a way to go about treating the ailment?
So it's two in the same, and it really takes the guesswork out of it for the doctor. So obviously you need to, rule out other things. You need to have your orthopedic testing, your functional testing, taking a good history is all part of the exam. But then really watching where the patient's pointing, how they're describing their injury is going to tell you a lot about what exactly it is. And not all cases are a fascial distortion case, but more often than not, if there's a soft tissue component, there's a fascial problem. So if the patient is pointing at their shoulder, for instance, and really grabbing the joint, that cues me into this is more of a what type of problem it is and how I'm going to treat it based on the way that they're describing it. So a lot of the diagnostic and treatment parts are lumped together in the way that you're discovering both at the same time. Does that make sense?
Yeah, it does. And, I could see how this would be useful because, as we've talked about before, a lot of times where a patient is feeling the pain is not where the origination is. So, for example, in my history, I've had, some back of my head and my neck and that sort of thing. And I thought, well, that's where the pain is, so that's where the problem is. It was actually down in my back. And you probably run into that all the time, don't you?
Yeah, and that's the other thing with this, too, is, you have the ability to spread pain or move pain because of the way that you're affecting the tissue. So it sounds scarier than it is, but it's also it's kind of a good thing if some patients will come in and say, well, it was really on the right side, and I felt better on that side, but today my left side hurts, and it's I wouldn't be concerned. I would take that in as okay, we're affecting this thing. I just need to get it. I just need to keep going on it to get rid of it. So patient feedback and body language is key with this technique, and it's a lot of, like I said, it takes a lot of the guesswork out and makes it very kind of cut and dry when, in fact, the fascia is the source of pain. Then, you can kind of nail it down with this.
Tulsa Spine and Rehab has a range of treatment options available to address your aches and pains. Give them a call to see how they can help you. 918-743-3737.